Welcome back to Pharmacy Review. Today, we're diving into an essential part of pharmacy operations, record keeping in Utah pharmacies. Whether you're a pharmacist, technician, or student preparing for licensing exams, understanding these laws is crucial for compliance and patient safety. Pharmacy records aren't just paperwork. They're a vital part of ensuring patient health and legal compliance. In Utah, pharmacies must follow specific retention rules for patient profiles, controlled substances, and prescription data. Plus, access to sensitive health records is strictly regulated. In this video, we'll cover how long pharmacies must retain patient records, who can legally access prescription profiles, key compliance rules, including drug utilization review and data security, reporting requirements for controlled substances, REMS, and privacy breaches. Pharmacy law is always evolving, and staying up to date is critical. So, let's get started and break down Utah's 2025 pharmacy record-keeping requirements. Disclaimer: this channel provides educational content on pharmacy law, summarized by artificial intelligence. While efforts are made to ensure accuracy, information presented here may not be comprehensive or up to date with the latest legal developments. This content is for informational purposes only and does not constitute legal advice. Viewers should consult a licensed attorney or qualified professional for specific guidance related to pharmacy law and regulations. The creators of this channel are not liable for any actions taken based on the information provided. Always verify details with authoritative sources such as government regulations, professional organizations, or legal experts. Section 8. Record keeping. Patient record keeping is a critical part of pharmacy operations, not only for ensuring safe and effective medication use, but also for compliance with legal and ethical standards. In this session, we'll cover the creation, storage, access, review, and protection of pharmacy records, including how long they must be retained and who is authorized to access them. Maintaining patient profiles. What's required? Let's begin with patient medication profiles. Whenever a pharmacy dispenses medications to a patient on a recurring basis, that pharmacy must maintain a patient profile for at least 1 year from the date of the most recent fill or refill. There's one exception. Hospital pharmacies may delete a patient's profile upon discharge, as long as those records are kept within the hospital's official medical record system. What must be included in a patient profile? The responsible pharmacist or DMP determines the format and additional details, but the minimum required information includes patient demographics, full name, address, phone number, date of birth or age, gender, medication and allergy history including known allergies and drug reactions, list of medications dispensed by the pharmacy with drug name, strength, quantity, date of fill or refill, charge to the patient, additional relevant comments about the patient's drug use, if applicable. These entries may be made by a pharmacist, intern, technician trainee, or DMP designee. Digital records and print requirements. Pharmacies can maintain patient records digitally, and there is no requirement that they also retain a printed copy, as long as the records are readily retrievable upon request. For controlled and legend prescriptions, the rules differ slightly in terms of retention periods. Controlled substance prescriptions must be kept for at least 5 years, in either written or electronic format. This includes refill data and must be immediately retrievable. Legend drug records follow the same 5-year rule, unless otherwise stated. Who can access or receive patient records? Pharmacy records contain sensitive health information, so access is strictly limited under Utah Code 58-17b-604. Here's who can access a patient's prescription or medication profile: the patient themselves, or their legal guardian or designee. Law enforcement officers acting under proper authority. Authorized third-party payers. Pharmacists or pharmacy staff providing direct care. Prescribers involved in the patient's treatment. Another pharmacy or prescriber when the patient requests a prescription transfer. The patient's attorney with a notarized release signed by the patient. A parent or guardian for minors. A personal representative if the patient is deceased. Any release outside these categories would be a violation of state and possibly federal privacy laws. Pharmacist's responsibility. Profile review before dispensing. Before dispensing any medication, Utah law requires pharmacists to review the patient's profile for clinical appropriateness. This drug utilization review, DUR, must assess Inappropriate drug utilization. Therapeutic duplication. Drug disease contraindications. Drug-drug interactions. Incorrect dosage or duration. Drug allergy interactions. Signs of clinical abuse or misuse. This is codified in R156-17b-611, and it forms a cornerstone of responsible dispensing and medication safety. Additionally, if a drug is subject to REMS, risk evaluation and mitigation strategy requirements, the pharmacist must ensure that all safety protocols are followed before dispensing. Other reporting and privacy requirements. Let's briefly cover a few more regulatory touchpoints. Reporting to Drug Monitoring Programs, PDMP. Pharmacies must report controlled substance dispensing data according to R156-37F-203. Reporting adverse drug reactions, ADRs. Required when administering vaccines, as outlined in the Vaccine Administration Protocol Standing Order. Privacy breaches and data security. Utah's Protection of Personal Information Act, Chapter 44, requires notification in the event of a data breach involving personal health information, reporting fraud, abuse, or licensure violations. Currently, no specific requirements are outlined in pharmacy law for these, but they may fall under broader regulatory or ethical reporting obligations. Thanks for watching Pharmacy Review. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated on all things pharmacy. Got questions or suggestions? Drop them in the comments below. Until next time, take care and keep thriving in your pharmacy journey.